the World Health Organization now says that there are 70 COVID-19 vaccines in development around the world, with 3 already being tested in human trials. Let's bring in Dr. Peter Hotez, Dean of the National School of Tropical Medicine. He is also a professor of pediatrics and molecular virology and microbiology at Baylor College of Medicine. Doctor, good morning. Thanks for being here. You have talked us through this. We have talked about vaccines along the way. What does that development tell you about the possibility we may see a vaccine in the near future for everyone?
Well, thanks, Sandra. Yeah, things are moving pretty rapidly. There's now 3 in clinical trials, 1 in China and 2 in the U.S. And this is just the beginning. We're going to have at least a dozen vaccines in clinical trials in the coming weeks. We hope our vaccine at Baylor and Texas Children's Hospital is going to be one of them. And then we're going to have to do that process of testing for 2 things. One, we want to make certain that the vaccine actually works. That's really important. Even if it works in laboratory animals, it doesn't necessarily mean it works in people. So we've got to figure that out. Then the second one is making certain that it's safe. You know, Dr. Fauci, who's been a mentor and like big brother to me for the last 40 years, has charged us with doing this in 12 to 18 months. It would be unprecedented, but you know, our group of scientists is working morning till night trying to see if we can make this happen. So it's a lot of sleepless nights, but we're doing our best.
And we are so thankful for that, Doctor. And meanwhile, you've got Dr. Fauci talking about this rolling re-entry back into the economy, kids going back to school again, with possibly May 1st being a target date, although he warned this is not a one-size-fits-all plan. So what do you think about that date, May 1st, for possibly starting to reopen some sectors of our economy?
Well, I would emphasize the point about it's one size does not fit all. And an example of that is here in the state of Texas. We're still climbing, so we're not going to peak, according to many of the models, until May 1st. So we're now getting our ICU beds filling up here in the Texas Medical Center, at all the hospitals in the Texas Medical Center. So we're not even in a position to even start thinking about that yet. So when May 1st comes around, we're going to be like New York was last week. So then that gets into a lot of complexity because if, you know, let's say parts of New York open up, you know, we've got an amazing business community here in the state of Texas. Are they going to feel a lot of pressure to say, hey, if New York's opened up, why aren't we opening up? And this is going to create a lot of complexity. So I don't claim to have an answer now, but it's going to have to be a very carefully orchestrated dance around what it means to open up one part of the country, but not the other. It sounds good. The science might support it, but there are going to be a lot of other considerations as well.
Yeah, and Dr. Hotez, Dr. Fauci talking about this is not a light switch. This is not walk in on all on switch all of a sudden because we see an improving situation. It depends on where you are. As you just mentioned, Texas may not even be peaking until that point. That being said, we're learning more about how this disease travels. So if we were to reopen the economy, send kids back to school, there would obviously be the fear that we'd have to shut things down again if this returns in the fall. The CDC is now warning that the virus can travel up to 13 feet in the air and live on our shoes, Doctor.
Yeah, this is a study that's come out of China, and it was conducted in an intensive care unit. And I think the one piece about this is to remember how the virus behaves in the intensive care unit may be different from the rest of the world. We actually saw this. Remember, this is our 3rd coronavirus epidemic pandemic. We saw this with SARS in 2003, MERS in 2012, and now this COVID-19. And each time there was high rates of transmission in ICU settings, and lots of doctors got sick. So, you know, whether that applies to the life outside of the intensive care unit, we still don't really know. We do know this virus is pretty transmissible, a lot more transmissible than the other coronaviruses, and we're learning about modes of transmission. And then you have this very problematic piece that a high percentage of people with the virus have no symptoms, which we've never seen before in this type of coronavirus. So, you know, that also adds to the transmission. So that when you actually look at transmissibility of this virus, it's about as high as you get. I mean, this group of people are getting very sick in the ICU, and this other group that's walking around transmitting the virus. And we haven't really seen anything quite like this before. And this is what adds to all the complexities that we've been hearing about.
Dr. Peter Hotez, we always appreciate when you can join us. Thank you, and we hope to see you again soon.